fitness is very poorly defined in CLL. We do not have a specific score. So based on the toxicity profile of the drugs that were recently approved and became available, I just say that more than the general concept of fitness, some specific comorbidities are relevant, including cardiovascular comorbidities, renal function, because this is also associated with the type of concomitant medications the patient is taking, and these might influence drug-drug interactions with some compounds used in first line or in subsequent line of treatments. So probably we should consider cardiovascular comorbidities when selecting treatment in order to opt for a second generation covalent BTK inhibitors and avoid or try to reduce the risk of atrial fibrillation and hypertension. We can also consider a venetoclax-based regimen in this category of patients, while patients with poor renal function probably are more tricky to treat with venetoclax-based regimen because of the risk of TLS.